format tips you can give students that are going to be coming to see you, whether it's virtually or in person, for interviews this season?
Well, I think it's important to readdress some of the basic platforms of applications. In other words, their background, the programs they're coming from, highlight some of the strengths and some of the nuances of the pearls that they've learned in their home institutions. And then you really have to then transition into some of the differentiators. In other words, what are your interests? Why seek a position in urology? It's a surgical subspecialty, so it's not like, in the masses of one of the domains in primary care. So baseline first, or what I like to call the basic recipe of why you're a strong candidate for work ethics, interests, team play. Those are just the basic domains, but important. And then the second would be, hey, I'm also interested in urology because of this, because of this. My aim is to do this. I'm extremely impressed with how the field of urology has managed prostate cancer over the years. That second tier then is that lead-in for why I would be interested in applying to urology and why I see myself as a future urologist. I'll pause there because, believe it or not, that alone was almost 8 reasons and 8 aspects of why you would want to highlight in an interaction with us.
So if you don't mind, can you share some of the mistakes you've seen without mentioning people's names on applications or during interviews?
Absolutely. I think the number one thing is, I think it's not realistic for a candidate to interview and say, well, I'm going into urology because I really like posterior urethroplasties, and I really want to go through training and then do a reconstructive fellowship. I really want to specialize. I've been impressed with some of the techniques used for this complex entity. No. You cannot be sniper fire and pick some super sophisticated small element within urology. It's almost like the pre-med student already saying what specialty he or she wants. No. Worry about the basic fundamentals of science and get into medical school. The same thing with a medical student. Worry about the basic fundamentals of urology and try to accentuate your strengths, admit to some of the domains you might need work on, but explain why you would be an asset to a urology training program. Don't get into specifics from a medical student perspective.
Most people's questions are going to be the same. They've read about it online. They all kind of talk about things. How, in the virtual format, what are some things people can do? Is it about a better camera? Is it about better audio? Is there anything that can make them different from others when it comes to this virtual interview cycle?
I think that's a great question. I think in this mundane format of your head and your face is sitting on a desk and we just have lighting, I think dress appropriately. I think in today's forum, it's okay to kind of change the background. It doesn't have to be a white wall. It doesn't
like Tampa in the background.
Yes, it could be downtown somewhere, but make sure the acoustics are perfect. You don't want anybody to struggle with hearing you and you hearing us. But why not? Why not change the atmosphere? I wouldn't be in a bathing suit on the beach, but as long as you're professionally dressed, yes, you can change the environment. And yes, you also want to show some of the non-hardcore elements in a mundane, non-tangible format, which is a video format. In other words, we're highlighting some interesting hobbies, some interesting past work experience. All those now leave a lingering taste to the interviewing body when we go through various video interview formats.
All right, Dr. Carrion, last question. Why is Florida the best place to get your education when it comes to becoming a urologist in the future?
Well, now I'm going to defend the entire state of Florida. The programs in Florida are well equilibrated in terms of providing a top-tier education for that individual medical student that's seeking a profession in urology. Florida Urologic is an outstanding organization that keeps the nomenclature and the standard of education and training very even and a very high top tier. And then you can't beat the camaraderie, the teamwork, the alumni following. We form friendships that are lifelong. Florida Urologic also makes sure that all the academic teaching programs actively participate in the society as well as the residents, and forget that it's a beautiful state.
Thank you, Dr. Carrion. This is Urologic Fast Five.